I'm 25 years old. How many grafts do I require for my baldness? I want dense hair.
Thank you for your question. 25 years old, you submitted several photos showing different sides of your scalp, and you're asking a very common question. How many grafts do you need? And you express that you want dense hair. So before I discuss the question of grafts, I'll tell you that this question is probably one of the most common questions we have in hair restoration, because certainly that seems to be the natural place to go is for transplantation. So I'll tell you a little bit also about a treatment that we've developed called hair regeneration, which I think would be more appropriate for you, assuming that we're describing someone who would come to our practice. And basically this way I'm answering the question is to let you know what we would do if when someone like yourself comes to us. So to understand where you're at and where you're going, you clearly are someone who is young, who has had an early onset of hair loss, and you're progressing very fast. So to answer the question about the number of grafts, I'll simply be straight with you. You don't have enough grafts to cover that amount of space as well as to get the density that you desire. There's a common misconception that a hair transplant can be done over and over again. But the reality is, and unfortunately you're probably already experiencing some of this reality, is that if you look at this band in the back of your scalp where the hair will never fall out, it's a very limited width. And that is all you can potentially harvest for a transplant. So there's a mismatch between the area that needs hair and the area which you can transplant. Putting it to simple numbers, when you have the most hair on your scalp, you have 100,000 hairs. When you first notice that you've lost hair, you've already lost 50%. When you look at yourself on the Norwood scale, which goes from 1 through 7, you're closer to a 6 level, even though you still have some existing hair on the top of the scalp. In our practice, we've developed a treatment called hair regeneration. What hair regeneration does is treat the thinning hair and makes the thinning hair thicker. It's too straightforward in a way, in that when you think of hair loss, you think of a progression where hair is thinning. So as the genetics of your pattern emerges, every time your hair sheds and comes back thinner. Eventually it stops coming back altogether. What we do is we use a material called extracellular matrix. And extracellular matrix is derived for the purpose of wound healing. And what we have been able to establish and develop after first using this material for hair transplant in order to get better healing of grafts and of the donor area is we've been able to actually use it as a standalone procedure, combining extracellular matrix with platelet-rich plasma in a customized way based on treatments that we've done for several years. We treat patients who come to us from all over the world with this treatment. The idea is you want to stop losing hair. So that, from that perspective, a drug called Finasteride is an option. What I'm observing, particularly from those patients who come to our practice, is that most young men, because of the concerns of long-term sexual side effects as well as the continuous daily intake of a pill, simply don't want to take Finasteride, which means that it's not likely that you would want to as well. You can try it, and certainly it is an option for you. But I have also found over my 20 years of practicing this field is that a lot of times younger men don't respond as well to Finasteride. It can slow you down in terms of the progression, but this rapid frontal diffuse thinning at a young age tends not to respond as well. What we've learned from hair regeneration is that hair loss is not only about sensitivity to DHT or dihydrotestosterone. So in our practice, someone like yourself, we would first treat with hair regeneration. Even though you're very advanced, we have been impressed by a significant group of our younger patients who seem to respond very well. So we really advocate early treatment. We have treated males as early as 18 years old, and we have found them to respond very, very well. So there is certainly a time factor. The earlier we treat someone, the better the results are. We have approximately 5 years of data, and we've been able to show the sustainability and benefit of the treatment. We customize the treatment to individuals, and people who are advanced like yourself will sometimes do a second treatment to further grow out some of the hairs that were practically gone, that have come back relatively thin. Those we're able to make slightly thicker. So depending on, the goal is to really maximize the potential for each individual patient. So I think that it would be impractical if your expectation is to get density and volume with transplant, especially with this progression. You may still choose to have a transplant with a different perspective and understanding the limits of what you can do with the transplant, but you need stabilization and hopefully the potential of some reversal. So I always say that if every hair we save is a hair we don't have to transplant. We like doing transplants, but we like to do it when patients are stable and we've maximized the benefit of hair regeneration. The reality is the majority of our patients who we treat with hair regeneration are satisfied and don't feel they need to have a transplant. It's basically created a much needed solution that bridged the gap between drugs and surgery. When you talk to a man who is losing hair, you understand that most men do not want to have a hair transplant. And why is that? Because almost every man has seen someone with a bad hair transplant. And that unfortunately is what sticks out in your mind. So when you ask a man if you want to maintain your hair, would you be willing to do an injection? Uniformly, the answer is of course yes. So early treatment and hair regeneration has become, with hair regeneration, I should say, has become a significant option, and we have definitely been able to help a lot of people who years ago we weren't able to help. So with that understanding, learn more about your options, understand that there are limits of hair transplant. You don't want to be frustrated by the expectations not matching the results. So I hope that was helpful. I wish you the best of luck, and thank you for your question.